In microbiology, can you guess what is most frequently asked topic in microbiology? The most common topic in the postgraduate entrance, after analyzing around 150 question papers, is streptococcus. Most commonly asked, without a question on streptococcus, which are beta hemolytic, what are alpha hemolytic cocci, gram-positive cocci, there is no question paper. Second highest number of questions came from HIV. Nifugine, refugine, ripugine, different genes of HIV viral structure, etc. Maybe coronavirus will be the future short question going to come in the microbiology topic. The third highest is chlamydia, then comes Vibrio cholera, then immunoglobulins. Which immunoglobulin crosses the placenta, which immunoglobulin is primary immune response, etc. Then DNA RNA viruses, streptococci, diphtheria, TB, हम इस देश के वासी हैं, जिस देश में TB बहती है. So without a question on TB, there is no question paper. So when you open the textbook of microbiology, the aim, the ambition, the objective is not to master microbiology. Anyway, if you don't get a great rank, you will join MD microbiology. No big deal. That time your entire life is meant for mastering microbiology. For entrance exam, you don't need to master the subjects. So first remove the myth in your mind that I need to master. You can't master the subject. You are only preparing for the purpose of clearing a entrance exam smart way. Okay? So when you start your preparation, you should start with streptococcus. Then you should finish HIV, then chlamydia, then cholera, then immunoglobulin, then E. coli. Like that, I have given top 60 topics. Top 60 topics in the descending order of priority, what you need to revise when you go for the postgraduate medical entrance. So the idea is easy now. We have a deal that you're not going to read everything in the textbook. What we are going to do is we are going to revise smartly, selectively, with the end in mind, with the first things first, what is most commonly asked by the examiner towards the least commonly asked by the examiner, right? So same thing happens when you go to pharmacology. Pharmacology is a big ocean. There are people who do M.Pharm, who do MD pharmacology, who do PhD in pharmacology. But for an entrance preparing student, how much time do you have to master pharmacology for cracking the NEET PG? Hardly one week or 4 to 5 days of time is only available for you. So where do you start? What do you read first? What do you ignore? Very important. So any entrance you go, one question will come on bioavailability, first order kinetics, second order, zero order kinetics, first order kinetics, etc., etc., pharmacokinetics. One question invariably comes on the drug reactions. Then asthma drugs. What is the anti-asthmatic of asthma drug of choice in case of COPD patients? In COPD patients, all the bronchospasm is because of the parasympathetic overactivity. So that is the reason you require ipratropium bromide, which is vagolytic in nature, because all that excessive cholinergic activity is the main component of the bronchospasm in case of those who are having COPD with bronchospasm. So everything, anything about asthma drugs, you have to be champion. Then comes the beta blockers. What are sympathomimetic with intrinsic sympathomimetic activity? Which beta blocker? Which beta blocker is alpha selective, beta selective, blah, 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 which is lipid soluble. Everything about beta blockers you should know, because one question is going to come on beta blockers. Then comes ACE inhibitors, then autonomic nervous system pharmacology, then digitalis, then one question on antiretroviral therapy, then comes aspirin, then comes diuretics. Without a question on diuretics, there is no question paper in the past, in the present, in the future. You need to master. So that is the reason. Once more, I give you 60 topics in pharmacology. I don't want you to read all 60 also. Just read for me the top 20 topics. I'm going to take you to the top 1000 ranks, even if you master top 20 topics, right? So always the rule of preparation or anything in life is under promise, over deliver, rather than over promise, under deliver. I like to tell you that before you are dreaming to read a lot, first be very sure what are you going to read, what are you going to master in this limited, healthy time given by the God, right? That's very important in the next 60 days. So in this list, I give you what are the 37 topics you have to master in forensic. What are the 94 topics, out of which at least the top 30 topics you need to master in SPM or PSM, what do you call it? SPM, sleep promoting medicine, right? Social and preventive medicine. Okay. So what you need to master, I leave this literature for you. Okay.